Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
I'm Dr. Roger Short.
So today we have a special guest. Dr. Short is a plastic surgeon, and he is going to be talking to us today about carpal tunnel syndrome.
Then we're going to be doing a live facelift on me. I want to look like Bradley Cooper.
Oh, no problem.
From The Hangover.
Absolutely.
Not A Star Is Born.
The morning after.
Yeah.
So, Roger, what is carpal tunnel syndrome?
So carpal tunnel syndrome is compression of the nerve that runs through the wrist. It gives numbness and tingling to the fingers, the thumb, the index, and the long finger, sometimes the fourth. People describe clumsiness in their hands. They have trouble lifting things that are small, doing up buttons, talking on the phone, they get symptoms, wakes them up at night. So compression of the nerve.
And that's your median nerve, right?
It's your median nerve.
Median nerve. So who gets it? Is this something that kids get or old people get or everybody gets?
I don't see it much in kids. It's mostly for adults. The vast majority of people, we don't probably come up with a clear explanation, but there are certain risk factors: rheumatoid arthritis, diabetes, hypothyroid, pregnancy, and so during pregnancy women can get it. But most patients, we probably don't find the cause.
Okay.
Okay, so carpal tunnel syndrome, numbness and tingling in the first three fingers, sometimes the fourth. We identified some risk factors. Have you ever seen after fracture, someone breaks their wrist, they develop carpal tunnel syndrome?
That wouldn't be very common. Ganglions can cause it though, aneurysms of blood vessels. So there's different causes, but the vast majority we would see just they show up to the office with progressive symptoms that are getting worse over time.
Okay, so someone comes in with these symptoms that you're talking about. How do you confirm the diagnosis? What do you do?
So when somebody comes to the office, we talk. The story gives away the answer most of the time.
Yeah.
Then we do some testing for strength. We do some testing to see if I can irritate the nerve a little bit with some of the maneuvers we do.
Paul can be irritating sometimes.
Paul can be
Irritate any
irritating.
nerve.
Yeah, that's very true.
Some of our videos will.
And then nerve studies can be done, and I don't do those. I send patients either to a physiatrist or to a neurologist for the testing.
Okay.
Okay, so you've done basically a history, you've asked them about it, you've done a physical examination, you said you've ordered some investigations. So you've made the diagnosis, someone's come in, they have carpal tunnel syndrome. How do you treat it?
So there's a few different ways you can treat it. It depends on how severe it is and really how much time people want to put into it. The simplest thing is just to modify your activities. So activities that don't cause a lot of flexion or extension of the wrist. People can use splints. So at nighttime, we tend to sleep with our wrist bent. And if you wear a splint that keeps it straight, there's not so much compression on the nerve. Temporizing measures could be a steroid injection. And then really it comes down to surgery. And surgery is the treatment that I provide most of the time for patients with severe carpal tunnel syndrome.
Just going back a little bit, Roger, you talked about flexed wrist. In the society of keyboarding and computers, is that a problem for people? Do they get that from sitting in a specific position at work?
It can be. A lot of people talk about using the mouse or repetitive syndrome, repetitive use syndrome, but I would say any position that keeps your hand flexed, your wrist flexed, or extended, or puts a lot of pressure on the wrist can contribute to
Are they still going to be able to click like and subscribe on this video?
Oh, absolutely, and they can use a thumb if it's a phone.
Nice. Okay, so say the patient has decided to go ahead with surgery because they feel like their life has become debilitated enough. What does that look like? What does the operation look like?
It's a pretty minor procedure.
Go ahead.
We would just make a little incision right in the crease here in the wrist. Probably 2-3 centimeters long. It's all done under local anesthetic for the vast majority of patients. Some patients really are uncomfortable with that idea and wish to go to sleep, but for most of my patients we do it with just local anesthetic. There's a tourniquet on the arm so that we can see well, and then the tourniquet is only up for about 5 minutes, and there's about 4 stitches on the outside. They come out 2 weeks later. I have patients moving right away so that their fingers don't get stiff. The dressing comes off in about 3 days, and it's just a Band-Aid. So the surgery itself is pretty brief.
Okay.
So straightforward operation, but like we tell all our viewers, every surgery has the chance of risks and complications. Are the chances of something bad happening high, low, and what are the risks with this surgery?
Yeah, so what I would tell patients is the recovery can be fairly long, up to about 4 to 6 weeks. For a physical job, they might have to take that time off work. Common things like wound healing issues, tenderness, bruising are all possible. If you don't do your physio after surgery, you can get quite stiff, and that can then take a long time to get the movement back. Major injuries like injury to the nerve, leaving a small band of tissue which would actually make you worse, are quite rare, and it can come back. It's usually one of those things that would come back after 10, 15 years if it's going to, so not right away.
How long to go back to careers like a hand model, like George
Hand
Costanza?
model, George Costanza would be back at work in about 3 months.
Okay, 3 months. Okay, that is very, very useful information. Anything else, Paul?
That's it. You've got the history where you're having numbness, tingling in the fingers, physical examination, you might have some weakness. There's going to be some investigations to look to see how that nerve is working, and then treatment options. We're going to splint, maybe some steroids, and ultimately surgery if nothing else works. Is that it in a nutshell?
Yeah, that sounds good.
All right.
Well, if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own carpal tunnel.
And thanks to Dr. Short for being with us today.
Thank
Pleasure.
you.
Pleasure.
See you next time.